break, an Indianapolis doctor is getting national attention for his part in a clinical trial to bring a first-of-its-kind treatment to patients with pulmonary hypertension. News 8's Angelique Hockaday spoke to him about his work, and Angelique, he says this could help a lot of people.
That's exactly right. Good morning. Dr. Ravichandran wasn't predicting the future when he first joined a clinical trial for a new way to treat scarring in the lungs. Now, a patient part of the study says the treatment saved her life, and the doctor says it could help thousands more COVID-19 patients.
I just could not catch a breath, and it's scary.
That sense of fear becoming all too familiar for a once active Gloria Mount.
If I was going to clean the living room, I'd maybe be able to dust one table.
She says the exhaustion of doing small things, making the bed, grocery shopping, or even walking,
I was constantly going like this,
started to have a negative impact on her life.
And the treatments they gave me had not had any effect.
A chance introduction to Dr. Ravichandran at Ascension St. Vincent in Indianapolis changed that. He was recruiting for a clinical trial to study the impact of inhaled treprostinil to treat pulmonary hypertension. And Gloria checked off all the boxes.
So scarring of the lungs, causing really high pressures in her lungs, causing the right side of her heart to fail.
In other words, all things that can lead to pulmonary hypertension,
which is a fancy term for high blood pressures in the lungs.
The hospital was one of 40 centers part of the trial, but made up nearly 4% of participants.
We have a lot of rural areas where there's a lot of farming going on, so is there some sort of chemical or dust exposure that may have happened throughout one's life?
Dr. Ravichandran says scarring of the lungs sounds like taking off a Velcro strap. His goal? Similar to putting it back together.
Do things with my grandkids, go to some of their games if we're allowed to.
You could walk 4 times the distance you could at the beginning of the study.
And after 16 weeks, success for patients like Gloria, and now potentially thousands more.
So we've clearly seen a lot of patients that have scarring of their lungs that are residual from COVID. Could this type of patient be more common?
Dr. Ravichandran told me data from the trial is now under review for FDA approval. The next phase of the study is to look at hospitalization and mortality rates, and of course, more research on the drug's effectiveness for those COVID-19 patients. Back to you.
Angelique, thank you. It is 7:47.